The press conference is the first of daily briefings, all of which will be broadcast live by GBC at 4 p.m. Fabian Picardo, who was joined by the medical director, Chris Rawal, confirmed the 3 cases of COVID-19 so far, 2 of which had been given the all-clear. In answers to questions from the media, Mr. Picardo said the 2 new cases announced this week had been locally transmitted.
Right, so cutting to the chase. Today, I can tell you that the total number of people confirmed as having been infected with COVID-19 in Gibraltar has been 3. That is a cumulative number from the first number that we reported. Of those, I'm very pleased to be able to tell you that 2 have now fully recovered. Another one remains infected, but well. This patient is in hospital, but is only mildly unwell. We've now sent a total of 100 swabs for testing. We have 48 results pending, and we have had 49 negative responses. But I think it is clear that we're dealing with community transmission, and I think that we need to be alive to that, and that's why the government has ramped up the response. We would not have ramped up our response if we didn't believe that we were in a situation of community transmission.
So these patients hadn't travelled.
I'll allow Christian to give you a full answer.
Absolutely, Chief Minister is entirely correct. Both of these patients have not travelled to their community transmission. The patient who is currently with an active infection is in that older age group, but is remarkably well and is being cared for very, very ably at the hospital. The second patient who tested positive has essentially had an immune system which has fought the virus and shaken the virus off, and then we've had a subsequent swab which has turned back negative, which actually, in the majority of the population, is the normal course of events.
He also revealed that there were 24 ventilated beds now at St. Bernard's Hospital, up 19 from the usual 5. Staff are being redeployed to ITU as other routine services are reduced.
And as Chief Minister quite rightly says, we now have 24 ventilated beds, so 24 spaces for patients capable of full ventilation. On a normal day, so before we started to deal with the COVID-19 issue, we would run 5 beds. And those 5 beds are the number of beds that would require a patient who needs to be ventilated, and that would be working on maximum capacity on a normal day, scaled according to our population and the demands on our health service. We would also run a number of beds which did not require ventilators, but would require what we would call maybe high dependency, so that's just greater intensity of nursing care but wouldn't require the ventilator. So essentially we've gone from 5 ventilated beds to 24, so close to a 500% increase.
House testing for the virus will be available locally in Gibraltar within 7 to 10 days. This means test results will be ready in hours as opposed to days, which is the case now as they are being sent to the UK. Mr. Picardo said the situation in schools was being closely monitored, and the decision continued to be to keep them open for now, although 60% of pupils were absent today, as well as 20% of teachers.
We've noted the advice of the NASUWT in the UK that our schools need in particular to continue to impart the curriculum to those of our children who are undertaking GCSE and A-level students whilst these are not postponed by the United Kingdom. This is an important fetter on our ability to make freestanding decisions about schools in Gibraltar. Today, 20% of teachers have been absent from our schools, and 60% of pupils have been absent from our schools. The GHA are contacting teachers with medical concerns relating to themselves or others that they cohabit with to provide them with advice and reassurance where appropriate. After consultation with the NASUWT committee, schools still remain open for now.
Tomorrow's press conference will be chaired by Public Health Minister John Cortez and Public Health Director Sohail Bati.
Every day at 4 o'clock, and you'll be able